I mean, if you have doubts whether the audio is functioning or not, it has nothing to do with audio. I'm absolutely still. Right. So a very good evening, all of you. Welcome to our dinner session. So in fact, as I mentioned previously, the original schedule is at 7 p.m. IST, but because of my own constraints and also due to the feedback I've been getting, the 9 p.m. IST seems to be a more appropriate time. So we'll have our regular dinner sessions at 9 p.m. Okay. So I hope the time is okay with majority of you, even though it's not possible to satisfy everyone. So that's what democracy is all about. So very good evening once again. So how are you guys doing? How has been your day? So some of you have started your day early with our 5 a.m. club. So how is it going? So are you experiencing the difference? It's been almost 3 days. This is our third day. So are you experiencing any difference? So let's go ahead with our MCQs discussion. And if you have any issues with streaming, do let me know in the comment section. Right, so let's go ahead. Yes, so first and foremost, so I've been giving you some questions simultaneously as critical thinking assignments or homework questions. In fact, we have been working on today's study club assignment, and we posted around 15 questions in study club. So you guys can check it out, registered students. And that's the reason why there has been slight delay in starting this session. Now that we are done with those questions, now let's move ahead with our dinner session as planned. So first and foremost, we'll start with the following question based on the composition of LA. So I'm sure this is something which almost every one of you are familiar with, as it is important even in university theory exam point of view and also in Viva point of view. So pain or burning on injecting local anesthesia is attributed to which of the following components of local anesthesia? As you know, we have so many components, starting with the anesthetic itself, lidocaine, xylocaine, it can be any agent. And along with that, we have this other important constituents like vasoconstrictors, sodium bicarbonate, sodium metabisulfite. So I'm sure you might have heard all these names. So which among them is responsible for pain or burning on injecting LA? So which is the culprit? So you have vasoconstrictors, sodium bicarbonate, lidocaine, sodium metabisulfite. And again, as I've been reminding you for the past 2 sessions, always keep 3 things in mind when you're attending these live sessions. First and foremost, assume that these questions are going to come on the final exam day. That gives you a kind of seriousness and you'll not take things for granted. And second, maintain notes. Third, enjoy the process, right? So always keep these 3 aspects in mind. And yeah. Also, we have this scoring system. So we have 5 questions, 4 marks each, maximum of 20. So at the end of the session, you can present your scores, okay? The majority of you have chosen option D. Very good. Option D, sodium metabisulfite is right answer. So first of all, we'll look into some of the components, including sodium metabisulfite. This sodium metabisulfite is added as a stabilizer, and it tends to make the LA solution slightly acidic, which is responsible for this pain or burning sensation, right? Rather burning sensation when injecting local anesthesia. So sodium metabisulfite is added as a stabilizer. It makes the solution more acidic and may contribute towards pain or burn on injection. And most importantly, it also has allergic potential. Do make a note of it. It may also provoke an allergic reaction. And coming to sodium bicarbonate, so it's added to lidocaine with adrenaline to neutralize the solution, reduce the pain of injection, and increase effectiveness, the functions of sodium bicarbonate. The purpose of adding it to LA. Buffered solution should be discarded after 1 week. because of the effectiveness of it, because the discarding has to be done as the effectiveness of adrenaline decreases over time. So according to literature, buffered solution should be discarded after 1 week because the effectiveness of adrenaline decreases by almost 25% during this time. And coming to vasoconstrictor, this is something again which you are very much familiar with. Let's have a review. The functions of vasoconstrictor in an anesthetic solution are to increase the duration of local anesthesia, right, by at least 30 to 50%, but only in combination with short-acting local anesthetics such as lidocaine, prilocaine, marcaine, etc. Increases the depth of anesthesia, it decreases intravascular uptake. So the toxicity risk is also reduced subsequently, and reduces operative bleeding through vasoconstriction and reduces systemic toxicity. Vasoconstrictors are unstable in direct sunlight and heat. Therefore, LA solutions, recommendation is those containing LA solutions containing vasoconstrictor should be stored in dark, cool place, right? So these are some additional inputs. I hope they're helpful. So as majority of you have rightly chosen, option D is right answer. So those who have answered option D, award yourself +4, right? Now let's move on to the next question. Identify the instrument. Is it wax knife, spoon excavator, straight probe? None of the above. So which one do you think is more appropriate answer? So it seems it's a double-ended instrument. On one side, you have a knife-like structure. On the other side, you have it appears like a spoon excavator, even though it's not exactly an excavator. Maybe in one context, it can be used as an excavator. So you have spoon-shaped end on one side. So it's a double-ended instrument. And also you have the, for sake of grip, you have the rough surface on the handle on both the ends. So what's this instrument? Is it wax knife, spoon excavator, straight probe? None of the above. By the way, this is something, let me give you a hint. This is something which you all have used in your first PDS. Okay, no changing of answers now. So as majority of you have rightly chosen, none of the above. It's very difficult to choose none because we, our tendency is to find an answer within the available options. But when you have none, we're always suspicious. But choosing none is a difficult decision to make, isn't it? Unless and until you are so sure. So none is right answer, by the way. So it is, as some of you mentioned, Lacron carver, but the spelling is not right. Can any one of you give out the correct spelling? Lacron carver. Okay, so it's Lacron carver used for fine trimming of wax. Denture construction or wherever you use wax, like in case of tooth carvings, that's where we actually are familiarized with this instrument, right? In fact, many of you are masters in using this instrument. So Lacron carver. So what's the spelling of Lacron carver? Very good. Yeah. Let me type out the spelling here. Yeah, we assume that since it is pronounced as Lacron, it is L-A-C-R-O-N, but no, it's not L-A-C-R-O-N. You can check out the spelling in the comment section now. It is L-E space C-R-O-N, Lacron carver. Okay, well tried, everyone. So anyways, spellings don't matter in an entrance, at least in an entrance. So none is right answer. Well done. So award yourself +4 if you have chosen option D, or else -1. Now let's move on to the next question. Which of the following allows most radiation to penetrate? Enamel, dentin, bone, amalgam, maxillary sinus space. So you can see some stripes on your right. So that is to just represent radiolucency and radiopacity, absolutely. But let's keep it aside. That's to make your slide even more romantic. So among the following options, which one do you think allows most radiation to penetrate? And see, all I can tell you is be cautious when you're answering this question. There's a greater chance that you might go wrong. You might think ulta. So is it enamel, dentin, bone, amalgam, maxillary sinus space? So which one of the following allows most radiation to penetrate? So let's try to understand the question. Allows most radiation to penetrate? Let's take enamel. It's all calcified. Do you think it allows radiation to penetrate? It doesn't. Most of the radiation is not allowed to penetrate. That's why it appears radiopaque, isn't it, on a radiograph? And then dentin, relatively, of course, it is also radiopaque, even bone. Amalgam, absolutely. It appears like when you compare them all, amalgam is the most radiopaque. It's a metal, right? Completely interferes with passes of X-rays or radiation. Whereas maxillary sinus space, it appears radiolucent on a radiograph, as you're all familiar with. So as majority of you have rightly chosen maxillary sinus space is a right answer. So radiopaque structures or materials, less radiation penetrates the structure and reaches the film. Hence they appear radiopaque. Always have this clarity, okay? No confusion whatsoever. So let me repeat, radiopaque structures or materials, these are those which allow less radiation penetration. So less radiation penetrates the structure and reaches the film. Radiopaque structures, as you know, appear white on processed film, and dense materials such as metals, enamel, dentin, bone. As you can see, options A, B, C, D, they're all radiopaque. Whereas radiolucent, they allow the radiation to pass through, absorbing very little radiation. More radiation penetrates the structure and reaches the film. Hence, we have this grayish black or blackish appearance on a film. Radiolucent structures appear gray to black on processed film. Less dense materials, including soft tissue and air space, maxillary sinus space being in air space, appears radiolucent. So if at all there is a question like, I'll give you the same options. If I ask you to arrange them in an order, starting from least radiopaque to most radiopaque, or vice versa, you should be able to answer, right? So usually, as I said, metals most radiopaque. So among the following, amalgam is most radiopaque. So the sequence, I'm sure you can take care of. Also, for sake of completion of this question, let me show you a radiograph of maxillary sinus space. Okay. I would love to place the image in this slide itself, but it's like giving you a hint to the right answer. So maxillary sinus, I'll just show you an illustration just for sake of completion of this slide. I'm sure you're all aware of like how it appears, right? So you can clearly make out upper molars, you can see a restoration relation to first molar, and occlusal or at the apical level in relation to molars, you can see a radiolucent zone to this entire space. So this is your maxillary sinus space, isn't it? Yeah. So now please award yourself plus for those who have chosen option E. Now let's move on to the next question. This is very, very important. Let's see. And most of us often make mistakes during our undergraduation while orienting these retainers with respect to tooth or teeth. Yeah. So the diagonal slot opening, which is evident on Tofflemire matrix retainer, as you can see in the illustration, number 3, marked as number 3, is placed facing occlusal aspect of tooth, gingival, facial, lingual. So which one do you think is more appropriate position of Tofflemire or universal matrix retainer, as it is frequently called? So which one do you think is more appropriate answer? I hope you got the question. Penultimate question, the diagnostic slot opening on the Tofflemire matrix, which is marked as illustration, number 3. I don't think it's very much clear. Yeah, but anyways, the diagonal slot, right? So which receives the ends of the band. So which direction should it face with respect to tooth? Occlusally, gingivally, facially, and lingually. So if the retainer is placed wrong, you're asked to remove and place it again. There is no compromise. Very good. There's majority of you have chosen gingivally, right? Option B is right answer. Why gingivally? So that's our next question. So why should the diagonal slot opening on Tofflemire retainer be oriented or placed towards gingiva? Why gingivally? Because only if it is oriented gingivally, as you can see, observe the illustration, it will be easy for you to remove the retainer from the matrix band in an occlusal direction, isn't it? Yeah, so that's the reason why the diagonal slot opening on Tofflemire retainer is placed facing gingivally. And also for your information, the matrix band, when you place a matrix band, you have a larger circumference and smaller circumference. So the larger circumference of the matrix band is placed occlusally, right? So that when you're restoring tooth, you're actually trying to cover up the entire circumference of the tooth. Again, this is very, very important because when you place a matrix band, you will have smaller circumference and larger circumference. The larger circumference of the band should face occlusally. I'm sure you all are familiar with this, isn't it? So now, having received some clarity, if you need any further clarification in this regard, feel free to get back to mail. As some of you are approaching through mail, I really appreciate it. Okay. Yeah. So those have chosen option B. Well done. And you should also know the reason why we do so. Good. So do award yourself +4. Now let's move on to the final question. Also, before we move on, just look into the parts of the Tofflemire matrix retainer and also try to be familiar with the parts. Okay. If there is an image-based question asking you to identify the name of the part or the function of it or its clinical relevance, you should be able to answer. So just make sure that you take a mental picture of this particular illustration which we are presenting here, Tofflemire matrix retainer. Okay. Yeah. Now let's move on to the final question, penultimate question of today's dinner session. It's a case-based question. A 52-year-old woman requests a removal of, Sujay, what about small circumference? See, in a matrix band, you have a larger and smaller circumference. When a larger circumference is placed occlusally, it means the smaller circumference automatically faces gingivally, isn't it? Yeah. So fifth question, final question, case-based, a 52-year-old woman requests removal of painful mandibular second molar. She tells you that she has not rested for 2 days and nights because of severe pain. Her medical history is unremarkable, except that she takes steroid, 20 milligrams of prednisone daily for her systemic condition, erythema multiforme. How do you treat this patient? Option A, have patient discontinue steroid for 2 days prior to extraction or give steroid supplementation and remove tooth with local anesthesia and sedation. Instruct patient to take antibiotic 1 hour prior extraction. No special treatment is necessary prior to extraction. Continue as usual. So which one do you think is more appropriate answer? Try answering this question. In the meantime, let's review some literature. Okay? Yeah. Also, we have some dental considerations. Consider them very, very important, and you can make a note of them. So first of all, here, since the patient is on steroid, when you're going for any surgical procedure, even extraction, it's a stressful situation, right? I'm talking about physiological stress. So in such a case, as a patient is dependent on steroids from external source, what about steroid production internally in response to stress. We have this fear that there wouldn't be adequate steroid production well within her body in response to these stressful stimuli. So in such cases, as majority of you rightly chosen option B, that is we give the supplementation, steroid supplementation additionally, and then proceed with extraction under LA and sedation. So let's review some literature. The fear here is that the patient may not have sufficient adrenal cortex secretion, that is adrenal insufficiency, to withstand the stress of an extraction without taking additional steroids. This holds true for any patient who has been treated for any disease with steroid therapy, right? Any kind of treatment. Patients with adrenal insufficiency, patients on steroid therapy, like in this particular instance, daily steroid therapy, and patients who have recently finished a course of steroids should receive steroid supplement for dental procedures. Consider this very, very important, and I would love to repeat this for you to make a note. Patients with adrenal insufficiency, right, or patients on daily steroid therapy, or patients who have recently finished their course of steroids should receive steroid supplement for dental procedures. And there are some general guidelines for management of patients on steroid therapy. So steroid supplement in patients who can develop adrenal insufficiency, as in this particular context. Early morning appointments, shorter appointments, our aim is to minimize this stress, isn't it? So early morning appointments, shorter appointments, minimizing stress, using sedation techniques when appropriate, modifying dental treatment plan when appropriate. And the major goal in these patients is to avoid precipitation of adrenal insufficiency. Okay, and also they're given a questionnaire. The concerns about adrenal insufficiency should be raised on basis of clinical history. In majority of cases, the dentist should ask the following questions. It is known that patient's adrenal glands do not function adequately. Is there any such report in her or his medical history? That is something which we should look into, the functioning of adrenal glands. Second, is a patient on chronic steroid therapy at doses of prednisone higher than 15 milligrams per day? Third question, has the patient been on steroid therapy at doses of prednisone higher than 15 milligrams per day within the last 2 weeks? So they should give us a clue, and a dentist should be familiar with patient's medical history. And if there is any doubt or any concern, without any hesitation, we should refer the patient to his or her physician for expert opinion on the same and for informed consent. Okay, right. So just keep these factors in mind as you guys rightly mentioned. So give steroid supplementation and remove the tooth with LA and sedation. And regarding antibiotic prescription, so we have this guidelines which we discussed a number of times, including the latest guidelines, antibiotic prophylaxis regimens. So you can get back through mail if you need any further clarification, or you can check out our e-classes test series where we've posted a lot of information in regard to this, including the tables which we'll come across in general medicine, endodontics, and various other specialties, especially oral surgery, isn't it? So as all of you rightly said, option B, give steroid supplementation, remove tooth with LA and sedation, award yourself +4 marks. Well done, everyone. So now you can post your scores. Yeah, do post your scores. I would love to have a look. So what's your maximum score out of 20? Yes, Nagmani will definitely consider a request on adding many questions to our regular live discussions. Yes, Archie. Yes, we have certain specific guidelines on when to give antibiotics and indications and contraindications. There have been several updates every year, and recent updates you can find in latest edition of standard textbooks. Deepika, what's the limit of steroid dose for having adrenal crisis? I didn't get your question, Deepika. See, usually when a patient is on steroid, the endogenous production of steroid is suppressed. So that's the concept out there. Try reframing your question, and you can use a doubt clarification form for assistance from our side. Okay. Yes, doubling the dosage. That's true. Okay, Arshi, you can follow. I mean, UK guidelines, US guidelines, that's fine. Also, do check out what guidelines are we implementing here in India once. And also, one of you were asking about crash course. Also, you guys can get back through mail at proudtobedentist@gmail.com for details on the same. So it's good to see your scores. Majority of you have scored 20 on 20 today. So that's really impressive. Yeah. Yes, of course. Of course, yes. If the patient is already on steroids. That's what we discussed, right? If a patient has adrenal insufficiency based on medical history, if the patient is taking steroids, or if the patient has taken steroids recently, as discussed, we go for supplementation. Yes, Nagamani, I already answered your comment. Yes, we'll definitely consider your request. See, you should understand that these are not just 5 multiple choice questions. In fact, from each of the question, again, you can reframe it. And from the given explanations or from the literature review we're having, we can create n number of questions. So do not look at them as just 5 questions. And also keep in mind that whether it is 5 questions or 1 question, as I mentioned, give your complete undivided attention. And I'm sure you'll definitely benefit from these sessions. And yes, of course, yes, we'll definitely consider a request. There is no issue in that. But for now, we'll stick to this particular format. And as the days come close, as we come closer to the entrance exam, I will also try to gradually increase the dose. Okay. Richard Cave. You've seen in literature review, I've mentioned about 15 milligrams, right? To check it out and also get back through mail. And all of you, if you have any doubts, feel free to get back through mail through our doubt clarification form. And I guarantee you that all your doubts will be clarified. It's not just about doubt clarification, but in the process of doubt clarification, you'll gain more confidence and you'll remember relevant topics or relevant questions indefinitely, because the doubt clarification form which we devised is based on active learning principle, right? So it's a very simple thing. All you need to do is get with your doubt, exactly what your doubt is, along with your standard reference, and most importantly, your analysis based on your reference. And if you get back through that format, we'll definitely assist you. In fact, we've cleared so far thousands of doubts in those formats to all our students, registered, not registered, doesn't matter. So just check out doubt clarification form and get back through mail for assistance from our side. Okay. So really appreciate your enthusiasm and well done, everyone. So just keep this consistency and momentum going. And as I said, if you have any doubts or you need any further clarification regard to any of the topics which we discussed here, feel free to get back through mail 24/7. Okay, right. So wish you all the best. Love you all. Good night. I'll see you tomorrow morning in 5 a.m. Take care.